Why do you want to work as a carer or care assistant for the HSE?
I want to work as a care assistant for the HSE because I believe in its mission to provide fair, compassionate care for everyone in the community. The idea that care should be based on a person's needs and not on their ability to pay is a value I share deeply. I am drawn to public service for this reason. I want to be part of an organization that sees the person first and makes a real difference in people's lives when they are often at their most vulnerable. My personal motivation comes from a strong desire to help people maintain their dignity and independence. I get great satisfaction from providing practical support, like helping with personal care or daily tasks, but I also know that the emotional support and companionship I can offer are just as important. I understand that the HSE serves a very diverse community, and I am committed to treating every individual and their family with respect, kindness, and patience without any judgment. Working for the HSE means I am part of a larger team dedicated to the well-being of the public. I am not just doing a job, I am contributing to the health of my community. I am a reliable and empathetic person, and I want to use these qualities in a role that has a true purpose. I am confident that my values align perfectly with the HSE's commitment to caring for people, and I would be proud to represent its principles every day in my work.
What is your understanding of the role of a carer?
My understanding is that the role of a carer goes far beyond just completing tasks like helping with washing, dressing, or meals. While these practical duties are essential, the true heart of the role is about providing person-centered care. This means I see the unique individual first, not just their condition or their needs. It is about building a trusting relationship and understanding their personal history, their preferences, and what is important to them. A central part of this is always working to promote a person's independence and maintain their dignity. My job is to support people to do as much for themselves as they safely can, offering encouragement and help where it is needed, rather than simply taking over. This could mean being patient while someone dresses themselves or involving them in choices about their daily routine. It is about empowering them and making sure they feel in control of their own life. Ultimately, I see my role as a companion and a supporter in their journey. It involves being observant, noticing any changes in their well-being, and reporting this accurately to the nursing team. It is also about providing emotional support and companionship, offering a listening ear and a friendly presence. For me, being a carer is a privilege that means dedicating myself to improving someone's quality of life by ensuring they feel safe, respected, and valued at all times.
What are the most important qualities a carer should possess?
I believe the most important qualities for a carer are a combination of heart and professionalism. First and foremost, a carer must have genuine empathy. This is the ability to understand and share the feelings of another person, which allows you to provide comfort and connect with someone on a human level, especially when they are feeling vulnerable. Closely linked to this is patience. Caring is not a rush job. It involves giving people the time they need to express themselves or to complete tasks at their own pace, which helps maintain their dignity and reduces their anxiety. Another essential quality is reliability. The people we care for depend on us for their well-being, so being punctual and consistent in our duties is fundamental to building trust and ensuring their safety. Strong communication skills are also vital. This means not only giving clear information, but, more importantly, listening carefully to what a person is saying, both with their words and through their behavior. Good communication ensures we are truly meeting their needs and working effectively as part of a team. Finally, a carer needs resilience. The role can be both emotionally and physically demanding, so the ability to stay positive, manage stress, and bounce back from difficult situations is crucial. This resilience ensures that we can continue to provide high-quality, compassionate care every day, without becoming overwhelmed ourselves. Together, these qualities create a foundation of trust and respect that is essential for making a real difference in someone's life.
How do you maintain confidentiality and respect a client's privacy in a home care setting?
Maintaining confidentiality and respecting a client's privacy is a fundamental part of building trust and providing safe care. My approach begins with understanding that all information about a client, from their medical details to their personal routines, is private and belongs to them. I only discuss this information on a strict, need-to-know basis with other authorized members of the care team, such as a supervisor or a nurse, and only when it is directly relevant to providing safe and effective care. I would never share details about a client's life with friends, family, or other clients. In a home care setting, this also means being very mindful of my physical actions. I always knock and wait for permission before entering any room, and I ensure that documents, care plans, or any notes are kept secure and out of sight, not left on a kitchen table. I am careful to have sensitive conversations discreetly, where I cannot be overheard by others. Furthermore, I follow the principles of the General Data Protection Regulation, or GDPR. This means I keep any written or digital records secure. I only use client information for its intended professional purpose, and I understand my responsibility to protect their personal data at all times. For me, respecting a client's privacy is about showing them that they are in a safe and respectful environment where they are in control of their personal information.
Describe a time when you had to provide care to a client who was initially resistant or unwilling to accept your assistance. What did you do?
I once cared for an elderly gentleman who was very resistant to me helping him with his personal care, like washing and changing his clothes. When I first arrived, he was quite clear that he did not want a stranger helping him. My first step was to not take this personally and to absolutely respect his feelings. I did not push him. Instead, I stepped back and said, "That's perfectly okay. I understand. I'm here for you, so we can do things at your pace." I then spent some time just sitting with him, talking about things he enjoyed, like his garden and his old job. I was patiently listening to understand the person behind the resistance. Through our conversation, I realized his resistance was not about me, but about his loss of independence and dignity. He felt embarrassed. So I modified my approach to give him back a sense of control. I suggested we could try a different way. I said, "How about I set everything up for you, and you do as much as you can yourself? I'll just be here to pass you things and make sure you're safe." This compromise respected his choice and ability. He agreed to try. I remained nearby, offering quiet encouragement and only stepping in when he specifically asked for help. This small change made all the difference. By listening, understanding his perspective, and adapting the care to focus on what he could do, I gradually gained his trust. He felt respected and in charge. After that, he was much more willing to accept my assistance because he saw me as a partner in his care, not someone taking over. It taught me that sometimes the most important care you can provide is patience and the willingness to listen.
Give an example of a time when you had a miscommunication with a family member, colleague, or another healthcare professional. What was the situation, and what steps did you take to resolve the issue?
I was assisting a client who had been feeling increasingly tired and had a slight loss of appetite over 2 days. I reported this to the nurse at the end of my shift, but I was rushed and simply said, "Mrs. Jones seems a bit more tired than usual." The next day, I learned the family was upset because they felt the situation had not been taken seriously, as the nurse had only recorded a small note about fatigue. I realized my initial communication had not been clear or thorough enough, which caused confusion and concern. To resolve this, I knew I needed to communicate more effectively. I first approached the nurse privately and apologized for my vague handover. I then used a structured method, which I understand is similar to SBAR, to ensure all the important details were shared clearly. I stated the situation. "Mrs. Jones has had a significant increase in fatigue and a poor appetite for 2 days. I provided the background. This is a change from her normal baseline. She usually enjoys her meals and is alert." I gave my assessment. "I am concerned she may be dehydrated or that there is an underlying infection." Finally, I offered a recommendation. "I recommend we reassess her vital signs today and consider informing her doctor." After this, the nurse and I then met with the family together. I listened to their concerns without interruption, and the nurse explained the new plan based on the clearer information I had provided. We made sure everyone agreed on the next steps for the client's care. This experience taught me that taking an extra minute to structure communication clearly is essential for patient safety and for building trust with both the team and the family.
What is your understanding of safeguarding? Describe a situation where you noticed something in a client's home or behavior that gave you a serious concern about their safety or well-being.
My understanding of safeguarding is that it is our fundamental duty to protect the rights, health, and well-being of vulnerable adults, ensuring they live a life free from harm, abuse, and neglect. This includes physical, emotional, or financial abuse, and it means being a vigilant and proactive advocate for their safety. I once provided care for an elderly gentleman who was usually cheerful and engaged. Over a few weeks, I noticed a significant change. He became withdrawn and anxious, and he would often make comments about his pension money disappearing too quickly when his adult son, who lived with him, was in a room. On one occasion, I noticed several unexplained bruises on his forearm. When I gently asked about them, he became very defensive and changed the subject, while his son seemed irritated by my question. These signs, the change in behavior, the financial comments, and the unexplained physical marks, gave me serious concern for his well-being. I knew I had a responsibility to act. Following the correct procedure was my immediate priority. I did not confront the family member, as this could have escalated the situation. Instead, as soon as I left the client's home, I wrote a detailed, factual account of everything I had observed and heard, including dates and direct quotes. I then immediately contacted my line manager to report my safeguarding concerns. I presented the facts clearly, without speculation, and provided my written report. I followed my manager's guidance and supported any subsequent steps, which I understood would involve following the HSE's formal safeguarding policy, which may include a referral to the dedicated safeguarding and protection team for a formal assessment. My role was to report promptly and accurately, ensuring the client's situation was heard and investigated by the appropriate authorities to keep him safe.
Describe a time you had a very heavy workload or multiple urgent tasks that needed to be completed quickly. How did you prioritize your duties to ensure the safety and quality of care for all your clients?
There was a challenging morning where I had several clients with tight schedules, and I received a call that one of my clients, who had diabetes, was feeling unwell and dizzy. This immediately became my top priority because it was a potential medical need. I quickly called my next two clients to inform them I would be slightly delayed, assuring them I was on my way. My first action was to go directly to the unwell client. I assessed her condition, checked her blood sugar, and stayed with her until she was stable, documenting everything carefully. After ensuring her immediate safety, I then organized the rest of my tasks. I prioritized the clients who needed essential personal care, such as help with getting out of bed and using the toilet, as these needs are fundamental to their dignity and well-being. Less urgent tasks, like routine tidying or paperwork, were moved to the end of my schedule. I also realized that with the delays, I would not be able to complete everything to the standard I expect without support. I calmly called my supervisor, explained the situation, and asked if a colleague could assist with one of my later client visits. By triaging the medical issue first, managing essential care next, and delegating when necessary, I ensured that every client remained safe and received quality care, despite the heavy workload. Staying calm and communicating clearly with both clients and my team was key to managing the pressure effectively.
What are your main strengths, and how will they benefit our clients?
I believe my main strengths are my empathy, my reliability, and my positive attitude. These qualities allow me to provide care that is not only competent but also truly compassionate. My empathy means I can understand and connect with what a client might be feeling, whether they are frustrated, scared, or lonely. This helps me provide comfort and build a trusting relationship, so the client feels heard, valued, and respected as an individual. This directly benefits a client's emotional well-being. My reliability means that clients and their families can always count on me. I am punctual, I follow care plans meticulously, and I am thorough in my duties. This creates a sense of safety and routine for clients, which is especially important for those who feel vulnerable. They know I will be there to support them consistently. Finally, my positive attitude helps me bring a sense of warmth and encouragement into a client home. I focus on what people can do rather than what they cannot, which helps promote their independence and lifts their spirits. For the client, this means their care experience is not just about tasks. It is about having a friendly and supportive companion who genuinely cares about their day. Together, I believe these strengths allow me to make a real and positive difference in the daily lives of the people I care for.
What do you see as the biggest challenge of the carer role, and how would you manage it?
I believe one of the biggest challenges of the carer role is managing the emotional weight of the job. We form close bonds with clients and often support them, and their families through difficult and declining health. It can be emotionally draining to provide constant compassion and support, and there is a risk of becoming overwhelmed or burnout. I manage this challenge by being very proactive about my own well-being. Firstly, I focus on the positive impact I make, no matter how small. Helping a client feel comfortable or seeing them smile reminds me why this work is so meaningful. Secondly, I believe in the importance of a strong professional boundary. This means being fully present and compassionate during my shifts, but also allowing myself to switch off afterwards, ensuring I have time for my own hobbies and family. Finally, I know I cannot do it all alone. I would make full use of the support systems available. This means having open conversations with my supervisor during supervision and leaning on my colleagues for advice and debriefing after a tough day. By taking care of my own mental and emotional health in this way, I ensure that I can consistently bring my best, most patient and positive self to work every day for my clients.
Describe a specific instance where a client became distressed, verbally aggressive, or exhibited challenging behavior towards you. What was your immediate reaction, and what steps did you take to de-escalate the situation safely?
I was assisting a gentleman with dementia who was having his afternoon tea. He suddenly became very agitated and verbally aggressive when I tried to help him with his cup, shouting that I was trying to poison him and telling me to get out. My immediate reaction was to not take it personally and to stay completely calm. I did not argue or try to reason with him, as I knew that would only escalate his fear. I took a small step back to give him physical space, which helps to reduce a person's feeling of being threatened. I used a soft, calm tone of voice and said, "That's okay, John. You are safe here. I will not touch your tea. I'm just going to stand here to make sure you're all right." I then shifted the focus away from the trigger, which was the tea. I noticed a family photograph on the wall and gently asked him, "That's a lovely photograph. Could you tell me about the people in it?" This distracted him and redirected his attention to a happy memory. As he started to talk about his family, his anger subsided and his posture relaxed. Once he was calm, I said, "I'll be just over here if you need anything," and I busied myself with a non-essential task in another part of the room, allowing him to feel in control again. After the situation was fully resolved, I documented the incident accurately, including the trigger, what worked to de-escalate it, and reported it to my supervisor so the care plan could be updated to note his sensitivity around food and drink, ensuring the entire team could provide consistent, understanding care.
A client expresses a wish to refuse medication or a specific part of their personal care that you know is vital for their health. How do you balance respecting their autonomy and ensuring their well-being?
This is a delicate situation that requires balancing deep respect for the client's choices with my duty of care. My first step is always to pause and listen without judgment. I would calmly sit with a client and say, "I hear that you don't want to do this right now, and I respect your feelings. Can you help me understand what is worrying you about it?" This opens a conversation, not a confrontation. For example, if a client refuses a vital heart medication because it makes them feel nauseous, my goal is to understand that reason. By listening, I learn the why behind the refusal. I would then provide clear, simple information about the importance of the medication, explaining the consequences of not taking it in a way they can understand, such as, "This medicine helps keep your heart strong and prevents you from becoming short of breath." I would also explore solutions together, such as asking if taking the medication with a small snack would help, or if we could schedule it for a different time of day. This approach involves the client in the decision. Ultimately, if the client still has the mental capacity to make an informed decision and continues to refuse, I must respect their legal right to autonomy, even if I disagree. I would not force the care. Instead, I would document the refusal in detail, along with the conversation we had and the information I provided. I would then immediately report this to my supervisor and the prescribing nurse. This ensures their well-being is still monitored by the wider team, who can follow up, reassess the care plan, or explore alternative treatments, all while upholding the client's fundamental right to choose.
You arrive at a client's home and notice a significant change in their condition, e.g., increased confusion, new swelling, or difficulty breathing. That was not present yesterday. You cannot immediately contact your supervisor. What are your immediate actions, and how do you document the incident?
My first priority is the immediate safety and well-being of the client. I would calmly approach the client and introduce myself, even if they know me, as a change like increased confusion can be unsettling. I would then conduct a quick but thorough assessment of the specific change. For example, if they have difficulty breathing, I would help them into a comfortable, upright position and check their vital signs if I am trained and equipped to do so. I would ask simple, clear questions to understand their level of discomfort. Since I cannot immediately contact my supervisor, my next step would be to use my clinical judgment to determine if this is a medical emergency. If the client is in severe distress, has significant difficulty breathing, or shows signs of a stroke, I would not hesitate to call for emergency services immediately. I would stay with the client, providing reassurance and monitoring their condition until help arrives. Once the immediate situation is stable or the emergency services are on their way, I would continue trying to contact my supervisor or an on-call manager to report the situation. I would also try to reach the client's designated family member or next of kin to inform them. For documentation, I would create a detailed, factual incident report as soon as possible. I would write down exactly what I observed, the time I arrived, the specific changes I noticed, the client's own words, the vital signs I recorded, and all the actions I took, including the time I called for emergency help and who I spoke to. This precise documentation is critical for ensuring a smooth handover to the paramedics, my supervisor, and the client's family, and for maintaining continuity of care.
Detail the steps you take to maintain strict infection control in a client's home environment, e.g., preparing a meal, assisting with personal care, or managing soiled laundry.
My process for maintaining strict infection control begins before I even touch a client. The first and most crucial step is performing proper hand hygiene. I would wash my hands thoroughly with soap and warm water upon entering the client's home and again immediately before initiating any personal care tasks. Next, I would prepare a clean area by placing a clean towel or a disposable pad on the surface where my care supplies will be placed. I would then put on the appropriate personal protective equipment, which for personal care always includes disposable gloves and a plastic apron to create a barrier between myself and any potential bodily fluids. During the care itself, for instance while assisting with washing, I would use single-use cloths or wipes for different parts of the body to prevent cross-contamination. I would ensure that any products, like soap or cream, are applied using a method that does not contaminate the main container, such as dispensing it onto a clean paper towel first. All used supplies, like cloths and gloves, will be placed directly into a clinical waste bag if available, or a sealed plastic bag for disposal. After the care is complete, I would remove my PPE carefully by tearing the apron at the neck, rolling it inward, and then removing my gloves by pulling them off inside out, disposing of everything immediately. I would then perform hand hygiene once more. Finally, I would manage any soiled linen by placing it directly into a leak-proof laundry bag, ensuring it is not shaken to avoid spreading germs. I would clean any surfaces I used with a disinfectant spray or wipe. This entire process ensures that the client's environment remains safe and hygienic, protecting both them and myself from the risk of infection.
How do you cope with the emotional challenge and stress that comes with caring for clients who are nearing the end of life or who pass away while under your care? How do you support the client's family?
Caring for clients at the end of their life is both a profound privilege and a significant emotional challenge. My approach to coping begins with focusing on the quality of care I provide. I find purpose and comfort in knowing that I am making their final days as comfortable, dignified, and peaceful as possible. Simple acts like ensuring they are pain-free, holding their hand, or speaking to them kindly are deeply meaningful. This focus on their comfort helps me manage my own feelings. To prevent burnout, I am very proactive about my own well-being outside of work. I rely on a strong support network, which includes talking confidentially with my supervisor and debriefing with trusted colleagues who understand the unique nature of this work. I also make sure to maintain a clear boundary between my professional and personal life, allowing myself time to process my grief through quiet reflection or physical activity. When supporting the family, my role shifts to one of a compassionate and steady presence. I practice active listening, allowing them to talk, cry, or simply sit in silence without feeling the need to offer solutions. I provide practical support, such as making a cup of tea or explaining what is happening in simple terms, which can be a great comfort. I ensure the client's wishes are respected, and I maintain their dignity at all times. After a passing, I offer my sincere condolences and give the family space and time, assuring them that their loved one was cared for with the utmost respect. This holistic approach, focusing on both the client's dignity and the family's emotional needs, helps me find a sustainable way to manage the emotional weight of this vital work.
Tell us about a time you identified a potential risk, inefficiency, or necessary improvement in a previous care setting, e.g., a safety hazard, a documentation issue, or a flaw in a routine. What suggestion did you make, and what was the outcome?
In a previous care setting, I noticed a potential risk during our medication rounds for clients who manage their own tablets. The system involved a staff member verbally reminding the client to take their medication from a dosette box. I observed that there was no consistent record to confirm the medication was actually taken, which was an inefficiency and a safety risk, as a client could forget or become confused. I identified this as a flaw in our routine that could lead to a missed dose or an accidental double dose. I thought about a simple and respectful solution. I suggested we introduce a discrete, double signature log sheet. When a staff member provided the prompt, they would initial the sheet, and then the client would also make a simple mark or initial once they had physically taken the medication. This empowered the client in their own care while creating a clear, auditable trail. I raised this concern respectfully with my manager during a team meeting, presenting it as a way to improve both client safety and our documentation. My manager agreed that it was a necessary improvement. The outcome was that the new log sheet was trialed and then adopted for all clients who self-administered. It provided peace of mind for the team, ensured greater accuracy in our records, and most importantly, added a crucial layer of safety for the clients, giving everyone more confidence in the process.
What protocols do you follow when assisting a client with their medication, e.g., promptness, documentation, and reporting refusal or side effects? What steps must you never take regarding medication?
When assisting a client with medication, I follow a strict protocol to ensure their safety. First, I always perform hand hygiene and prepare the medication in a clean, quiet area to avoid distractions. I then carefully check the medication administration record (MAR) against the medication packaging, verifying the client's name, the correct medication, the exact dosage, the right time, and a proper route such as oral or topical. I do this 3 times, when I take the pack out, when I portion the dose, and again before I give it to the client. I then assist the client promptly at the prescribed time. I stay with the client to ensure they have swallowed the medication completely. Immediately after, I document the administration on the MAR, signing and dating it to create a precise legal record. If a client refuses their medication, I would not force them. Instead, I would calmly explain the importance of the medication, listen to their concerns, and if they still refuse, I would document the refusal clearly and report it to my supervisor and the prescribing nurse without delay. Similarly, if I notice any potential side effects, like a new rash or dizziness, I would stop the medication if it is safe to do so, monitor the client, and report my observations immediately. There are critical steps I must never take. I must never administer a medication that I have not been trained and signed off to give. I must never crush a tablet or alter a medication in any way unless it is explicitly prescribed to be taken that way, as this can be dangerous. I must never guess or make assumptions about a medication or a dose. Finally, I must never fail to document or report any event related to medication, as this information is vital for the client's ongoing care and safety.
Give an example of how you successfully communicated crucial information about a client to another member of the multidisciplinary team, e.g., a public health nurse, occupational therapist, or GP. Why was your input valuable?
I was providing daily care for an elderly gentleman who was recovering from a fall. While assisting him with his personal care, I noticed a small, unhealed pressure sore beginning to develop on his lower back. He had not mentioned it to anyone, and it was not in his current care plan. I knew this was a crucial observation because if left untreated, it could quickly become a serious wound. I needed to communicate this to the public health nurse who was responsible for his wound care. When I contacted her, I used a clear and structured approach. I first identified myself and the client. I then stated the situation, I'm calling because I've noticed a new stage 1 pressure sore on Mr. Jones' lower back. I provided the background. It's about 2 centimeters in diameter. The skin is intact but red and does not blanch when pressed. He has been spending more time in his chair recently due to his mobility issues. I gave my assessment. I am concerned it may deteriorate quickly without intervention. Finally, I offered a recommendation. I recommend a wound assessment at his next visit, and in the meantime, I will ensure we reposition him every hour and use a pressure-relieving cushion. My input was valuable because, as the care assistant, I am with the client daily and was the first to see this early warning sign. The nurse relies on these frontline observations to act promptly. Because I reported it early and with specific details, she was able to adjust his care plan immediately to include a new repositioning schedule and a special cushion. This prevented the sore from worsening, avoiding pain for the client and a more complex medical treatment. It demonstrated how effective communication between the multidisciplinary team leads directly to better, safer outcomes for the client.
How do you establish and maintain appropriate professional boundaries with clients and their families, particularly in a home care setting where relationships can become close?
Establishing and maintaining professional boundaries in a client home is essential for providing safe, effective, and sustainable care. I build these boundaries from the very first meeting by being warm and friendly, but also clear about my role. I explain that I am there to support their care plan and specific needs, which helps set a professional framework. I maintain these boundaries through consistent actions. I'm always reliable and punctual, starting and ending my shifts on time. While I am a compassionate listener, I'm careful not to share excessive personal details about my own life or problems. If a client or family offers a gift, I follow my organization's policy, usually politely declining anything more than a small token like a thank you card to avoid any sense of obligation. Perhaps the most important boundary is knowing the line between being supportive and becoming the client's only emotional support. If a client or family faces a complex personal issue, my role is not to solve it for them, but to listen empathetically and then suggest they speak with a more appropriate professional, like a social worker or counselor, and I can support that connection. This approach ensures the relationship remains therapeutic and focused on the client's well-being, which protects both them and me from burnout and ensures I can provide the highest standard of care for as long as I'm needed.
The HSE value is care and compassion. Provide a specific example from your experience where you went the extra mile to demonstrate care and compassion to a client that was beyond your routine duties.
The HSE value of care and compassion means connecting with a person behind a care plan. I once supported an elderly lady who had recently lost her husband. She was physically well cared for but deeply lonely and withdrawn, often just staring out the window. My routine duties were to assist with her personal care and meals, but I could see she was grieving and isolated. I knew she had been an avid gardener, so I decided to go a little beyond my routine duties. On my own time, I bought a small, easy-to-care-for potted plant, a bright geranium, and a bag of soil. During my next visit, after completing her personal care, I said to her, "I brought a little friend that needs a home and a gardener's touch. I thought you might be the perfect person to look after it." I set it up on her windowsill, where she spent most of her day. I then began to incorporate this into our time together. Instead of just preparing her tea, I would bring the cup to her windowsill, and we would talk about the plant, whether it needed water, or if a new bud was forming. This small act gave her a sense of purpose and a living thing to nurture. It became a gentle reason for her to get out of bed and a neutral, hopeful topic of conversation that slowly drew her out of her shell. This wasn't a grand gesture, but it was a specific and personal one. It showed her that I saw her not just as a client with needs, but as a person with a history and a passion. The extra mile was simply taking the time to understand what would bring a flicker of light back into her day, demonstrating care and compassion in a way that truly respected her individuality and emotional well-being.
Do you have any questions for us?
Question 1. Could you tell me about the specific induction and training program for new care assistants? I am keen to understand how you support new staff to become fully familiar with your procedures and the clients they will be supporting. Question 2. Could you describe the typical team structure here? I'm interested in understanding how a care assistant fits into the wider team and who my main point of contact for daily guidance and support would be. Question 3. Does the HSE offer opportunities for further professional development or training in specific areas, such as dementia care or moving and handling updates? I am very committed to continuously improving my skills to provide the best possible care.